Hello everyone, my name is Ebote Nnoko, a current DNP student at the University of South Alabama, a psychiatric mental health nurse practitioner. I will be presenting a quality improvement project on depression and quality of life in adults with chronic health conditions. The occurrence of depression is significant among individuals with chronic health conditions. Depression impacts roughly 10% of the adult population in the United States, though it often goes undetected or without treatment, resulting in an overall poor quality of life for the patient. According to the World Health Organization, in 2019, approximately 264 million individuals were affected by depression. Depression is often associated with unfavorable treatment outcomes for both the mental and the physical conditions. For approximately 30% of patients with chronic health conditions, depression is often unrecognized. Twice as many individuals with chronic health conditions experience depressive symptoms compared to the general population. The overall purpose of the project is to promote awareness and identification of depression in patients with chronic health conditions, with timely screening and appropriate follow-through of care for mental health problems and physical health issues of patients treated in primary care settings. The specific aim for this project was to have at least a 50% reduction in depression symptoms in adults with chronic health conditions at the primary care clinic, and at least a 70% increase in the number of patients screened positive for depression symptoms referred for depression symptoms management by a mental health provider, and also to improve the quality of life for these patients with chronic health conditions. The project needs: at the primary care clinic in the Southeast, professional nurses noticed that most patients with chronic health conditions were not routinely screened for depression, and for those experiencing depressive symptoms, they wanted to decrease depression through timely screening and appropriate referral for treatment. Methods. The methods used for this project include patients who were adults with chronic health conditions, the setting which was a primary care clinic in the Southeast. Instruments applied were Patient Health Questionnaire 9 for depression screening and the McGill Quality of Life Questionnaire that was used to follow up quality of life improvement during the project. Available knowledge. Notwithstanding overwhelming evidence to support the association of depression with chronic health conditions, many primary care settings do not routinely screen patients with chronic health conditions for depression. Depression is responsible for more healthy life loss years than any health condition. In 2019, the National Institute of Mental Health established an association between chronic health conditions with an increased risk of depression, estimating that about 10 to 65% of individuals with chronic health conditions become chronically depressed when ill. Studies show that many primary care providers often prefer to deal with the physical conditions rather than mental health issues. As a result, educating staff on administering and scoring depression assessment instruments is crucial. An increased amount of evidence supports screening those with chronic health conditions for depression symptoms is vital, as early intervention leads to improved quality of life, clinical symptoms, and a decrease in suicidal behaviors. Intervention. A clinic staff identify all participants who met pre-established inclusion criteria. Willing participants were informed of the purpose and the goal of the project. Staff with direct patient contact were trained on administering and scoring the PHQ-9 and the McGill Quality of Life instruments. All participants were scheduled for a visit within the first 14 days of the project initiation. All participants and staff were educated on depression symptom recognition. Patients were screened at the start of the intervention and at every follow-up visit with the PHQ-9 and the McGill Quality of Health instruments for 12 weeks. Professional nursing staff reviewed the questionnaire, scored, and recorded results in the designated section of the electronic health record. The provider reviews the score and makes appropriate recommendations. These recommendations include clearing the patients to participate in physical activities and referring some of the patients to a mental health provider. The information collected were analyzed after the 12-week intervention. The pre and post PHQ-9 and MQOL scores were compared. The number of referrals made to mental health providers pre and post intervention were compared. The results: after analyzing information gathered from this quality improvement project, 50 patients participated in the quality improvement project. 8 of the 50 participants passed away before the end of the project, not related to physical activities, and only 42 patients completed the project. The PHQ-9 pre-intervention score ranged from 5 to 22. The MQOL pre-intervention score ranged from 0 to 10, 0 being the worst quality of life. The PHQ-9 post-intervention score ranged from 0 to 12, while the MQOL post-intervention score ranged from 5 to 10. On this slide, we have two tables. Table 1 is for pre-intervention PHQ-9 and MQOL scores, and Table 2, post-intervention PHQ-9 and MQOL scores. For the pre-intervention PHQ-9, 10 participants had minimal to mild depression, 23 moderate depression, 10 moderately severe depression, and 7 severe depression. The MQOL scores were 7 to 10 for minimal to mild depression, 5 to 6 moderate depression, 3 to 4 moderately severe depression, and 0 to 6 severe depression. We could see from the scores that the greater the severity of the depression, the poorer the quality of life. For the post-intervention scores, 26 had minimal to mild depression, 16 moderate depression, 0 for moderately severe depression, and 0 for severe depression. And while the MQOL scores were 7 to 10 for minimal to mild depression and 5 to 6 for moderate depression. Now we could see that there was great improvement in the quality of life and also the severity of the depression, as there were no participants for moderately severe or severe depression. Discussion. Analysis of the data collected showed more than 71% of participants were referred to and managed by a mental health provider, meeting the targeted goal of 70%. 85% of all participants showed at least a 50% reduction in depression symptoms and improved quality of life. 15% showed no improvement in depression symptoms or overall quality of life. Conclusion. Depression in patients with chronic health conditions significantly impacts patient response to treatment and overall quality of life. Routine screening using the PHQ-9 in primary care settings is supported to identify patients at risk for depression effectively. The Quality of Life project shows early detection through screening and intervention improves symptoms, compliance, and the overall quality of life for most patients. Implication to practice. The project aims to promote depression screening in patients with chronic health conditions by identifying depression, improving awareness of depression comorbidity, and timely, appropriate referral to mental health services in a primary care clinic. Managing depression in patients with chronic health conditions will improve primary care patients' psychological and physical health. Maintaining patient mental and physical health will provide a holistic approach to care, a more positive outcome, and an overall improvement in the patient quality of life. This concludes my presentation. Thank you all for listening, and a special thank you to Dr. McCoy, my advisor, for all her support to make this project a success.